What is hoarding disorder? Hoarding disorder is a condition that makes it difficult for people to throw things away, regardless of their value. There are a range of treatment options available. Hoarding disorder can have a significant negative emotional, social, financial, and legal impact. Symptoms. Unlike collectors, who choose to collect a specific type of item, people with hoarding disorder tend to acquire various items. These may include piles of clothes, old magazines, food wrappers, and childhood trinkets. Over time, they may run out of room to store these things, so they may have to display their belongings chaotically. Some people with hoarding disorder might even start to acquire living things, including companion or farm animals. This can endanger both human and animal welfare due to factors such as overcrowding, unhygienic conditions, and a possible lack of veterinary care. Other symptoms that people with hoarding disorder may experience include emotional distress, such as being overwhelmed or embarrassed by their possessions or living situation, suspicion or fear of other people touching their items, obsessive fears and actions, such as checking trash cans for discarded items or a fear of needing an item in the future, feeling responsible for objects, and sometimes thinking of inanimate objects as having feelings. People with hoarding disorder also tend to experience associated issues with indecisiveness, disorganization, distractibility, procrastination. Typically, the symptoms of hoarding disorder will begin during a person's early teenage years, with the average age of onset being 13 years old. Complications. Hoarding disorder can result in a range of negative emotional, social, physical, financial, and even legal complications. Other common complications or consequences associated with hoarding disorder include difficulty functioning in daily activities, poor hygiene, poor diet or nutrition, living in unsafe environments, with factors such as tripping hazards, fire hazards, or large piles of items that may collapse, strained or severed marital, family, or friend relationships, social isolation and loneliness, lost work or employment, debt, reluctance to let others into their home, financial difficulties, legal problems, such as those involving child custody and animal welfare, lost property value or eviction. As well as these complications and consequences, people with hoarding disorder may also experience mental health conditions such as depression, attention deficit hyperactivity disorder, ADHD, anxiety disorders, alcohol use disorder. Treatments. With the right treatment, most people with hoarding disorder can reduce their major symptoms and the risk of complications. Healthcare professionals tend to treat hoarding disorder using a type of therapy called cognitive behavioral therapy, CBT. In some cases, medication may also play a role in treatment. This is particularly the case when hoarding disorder is related to other conditions that respond well to medication, such as severe anxiety or depression. Resource: MNT. Contact us at www.patientprimus.com.